Hi, I am Dr. Chaitanya KS. I am a board certified Ayurvedic practitioner. I graduated from Rajiv Gandhi University of Health Sciences. Currently, I practice in Bangalore. Psoriasis is known as one of the autoimmune disorder where the immune system is the main component of producing this disease. Though psoriasis is expressed as a skin disease, the root cause is immune system. So our body has immune system which will protect from our body from any kind of bacteria whichever comes from outside. So immune system has a definite identification factor where it differentiates between the self and non-self. Whenever the foreign substances like virus, bacteria comes, it destroys and protects our body from getting any kind of disease. Due to various reasons, this immune system starts attacking our own cells or like the self. So here in psoriasis, immune system attacks the skin and it impairs the skin production mechanism. Psoriasis is a kind of disease where the skin production will be occurring in very fast phase compared to its shedding. So we can see the symptoms like raised scales or patches. It can be anywhere in the body. So it's not limited to any one part of the body. It can appear any part of our body. So the definite cause for the psoriasis is not known yet, but there are, rather than looking as a single causative factor in the psoriasis, includes a multifactorial disease. So there are various factors which can contribute the production of initiation of the psoriasis. It may be genetics, it may be climatic changes, it may be trauma, it may be infections, or it may be due to psychological factors. There are various factors which can influence the disease. So generally symptoms of psoriasis are like we have a white plaques or silvery scales which we see in the patients, and there are other variations of psoriasis. The symptoms will vary mildly. So the types of psoriasis are, we can broadly categorize it into three types. One is depending on the nature of the disease, another one depending on the place or where it occurs, the other one is depending on the severity of the disease. First we look into the types of psoriasis which based on the disease. The commonly found psoriasis type is known as plaque psoriasis, where you have the silvery flake which is shedding or like the thickened skin or reddish patches which are very common in the psoriatic patients. So then comes the gutted psoriasis. The gutted means like droplet kind of stuff. Here the psoriasis which occurs seen as a droplet kind of size, which may vary around like 1 millimeter to 10 millimeters in size. It can appear any part of your body. So this usually doesn't have much of skin shedding or the scales are not visible much. Then comes into the erythrodermic psoriasis. Here we don't see the classical symptoms of flaky skin scenes, but generally we see a reddish kind of appearance, raised appearance all over the body. Generally it's a very rare condition of psoriasis. Next comes the inverse psoriasis. Inverse psoriasis is the psoriasis which generally we see in the skin folds, where the skin folds are there, maybe axilla, maybe groin, or any other parts of the body where we see like foldings. So it appears to be very shiny area. Flakes may be or may not be appear in this psoriasis. Generally it can occur along with the other types of psoriasis which we can found in the psoriatic patients. Then when we come into the places, we can see psoriasis in the scalp, which is known as scalp psoriasis. Psoriasis can be seen in the hand and feet, which are known as palmoplantar psoriasis. Psoriasis can be seen in the nails, which is known as nail psoriasis. So these are the variation of psoriasis which we can differentiate according to the place or the site. Then comes to the classification depending on the severity of the disease. So we have the mild psoriasis, like mild to moderate psoriasis, and moderate psoriasis and severe psoriasis, which depending on the severity of the psoriasis. So usually psoriasis covering more than 10% of body surface area, which is considered to be severe psoriasis along with the other symptoms. So generally psoriasis has various triggering factors which influences the disease. Triggers can be classified majorly into two groups, maybe either with the food habits or lifestyle, and there are various other factors which influence the disease. So general triggers are the weather. Mainly cold weather triggers most of the psoriatic patient, and there are few patients who get triggered by the summer also, and there are patients who stay stable like throughout the year without any much changes in their psoriasis. Then comes the dry weather. Dry weather is also one of the reasons for psoriasis. There are various other factors like obesity can increase the psoriatic flare-ups. There are infections which can increase psoriasis. Certain medications, certain beta blockers also can trigger psoriasis. simple some painkillers also can trigger psoriasis, and psychological factors like stress, anxiety, these things also can trigger psoriasis. So regarding to food, so there are many patients who experience these very oftenly. If they take certain spicy food or oily food, they may experience increase in their symptoms. Intake of too much of salt, too much of sour things, too much of spices, curd, milk or dairy products, nightshades and sesame products, jaggery and black gram, these kind of food articles which trigger psoriasis, which we can see commonly in the patients, or patients usually say do a detailed consultation about these factors. So not only these things, there may be some certain specific individualized triggering factors. For some people wheat can trigger, so certain people may have like gluten allergy that we can see in psoriatic patients. Some people may experience psoriasis trigger maybe through groundnut, consumption of groundnut. Some people experience psoriasis trigger by consumption of brinjal and other things.